Physiologically, B cells support the immune system in its fight against pathogens. However, during their development, B cells undergo multiple steps of differentiation and can sometimes turn malignant. Malignant B cells are functionally incompetent and divide unrestrictedly, crowding out healthy blood cells. Malignancies in B cells are often associated with impaired internal signaling via certain enzymes called phosphatidylinositol 3 kinases, or PI3K for short. Many cells signal via PI3K, but the PI3K delta isoform is only expressed in immune cells. It is involved in development and survival of B cells, making it a viable therapeutic target.
The standard for treating coronary artery disease in de novo lesions is currently the implantation of drug-eluting stents. However, especially small vessels are at risk of stent-related complications such as in-stent restenosis and stent thrombosis. The resulting disadvantage of DES is a prolonged dual antiplatelet therapy.
Endogenous coagulation factor VIII is a heterodimeric protein that consists of a heavy chain with the domains A1, A2, and B, and a light chain with the domains A3, C1, and C2. During its biosynthesis, factor VIII undergoes complex post-translational modifications, including glycosylation, sialic acid capping, and tyrosine sulfation. The attachment of glycans occurs mainly in the B domain, where glycans appear as branched bi-, tri-, and tetra- and ternary carbohydrate structures.
A key driver of inflammation and fibrosis in these patients is the mineralocorticoid receptor, or MR. Physiologically, the receptor regulates blood pressure, electrolyte and fluid homeostasis, and is involved in tissue repair and remodeling. In different organs, the receptor modulates the function of various cell types. Steroid hormones such as aldosterone or cortisol activate the receptor. Following the selective recruitment of cofactors, the receptor initiates gene transcription. However, the mineralocorticoid receptor can become overactivated, commonly referred to as MR overactivation.
When healthy, the throat's mucous membrane is lined by a serous fluid that effectively protects it and keeps it moist. However, various factors can dry out this protective layer. The mucous membrane is thus no longer adequately protected against pathogens like viruses and can quickly become inflamed. The result is a sore throat.
The most common disorder is bacterial vaginosis. In bacterial vaginosis, the healthy lactobacilli-dominated vaginal flora is replaced by anaerobic and facultative anaerobic bacteria, such as Gardnerella vaginalis and Atopobium vaginae. Typical symptoms include homogeneous grayish-white discharge, as well as an unpleasant fishy odor. During clinical diagnostics, the pH may be elevated above 4.5, and a typical microscopic finding is the so-called clue cell phenomenon. No redness or other signs of inflammation are observed.